Good day, everyone. My name is Gerald Ababa Bisara from BSN111F, a student from Davao Doctors College of Davao. Today, I will be performing the return demonstration of the abdominal assessment. Abdominal assessment is important if life-threatening intestinal pathology exists, most commonly obstruction perforation schema or vulvo. Use rapid and diagnostic dominant examination will be the single most important factor to avoid the mortality and to minimize the morbidity. So the first thing we need to do is to review the client's medical records if available, for us to know the previous medical history of the patient and to provide focus for the physical assessment of the patient and to determine the scope of the assessment needed and prepare the necessary equipment to save our time and energy. So the equipments that we need to use are the stethoscope, the metric ruler, the pin light, the pen, and the tape measure. So now that we are done arranging our materials or preparing our materials, let us now disinfect our hands using the alcohol. After disinfecting our hands and after fixing our materials, let us go and meet our client. Hi sir, good day. My name is Gerald Ababa Bisara from BSN111F, your student nurse for today. So for verification, may I know can I have your wristlet please? Okay, can you please state me your full name?
Joshua B. Fernandez.
Okay, how about your birthday?
Your and proper code.
Okay, so sir, what do you want me to call you?
Joshua.
What language or dialect do you prefer?
English.
Okay, English. So sir, today I will be performing an abdominal assessment as per instructed by the physician. So abdominal assessment is necessary because it can help us detect health problems in our clients earlier, and it can also prevent future complications from development with the existing disease, all right? So I would just kindly ask you to cooperate by answering my question honestly. So I will gonna ask you about your health conditions, your lifestyle, and so on and so forth. And I assure you that all information that you will give me will remain confidential within the two of us and also of the medical team. So are you good with that?
Yes.
Okay. So sir, so for your health history, do you have change in appetite?
No.
Okay. So your weight?
No.
Okay. So your do you have any respiratory problems?
No.
Okay. So wait, I will just document that. How about you? Do you have any undergo trauma or abdominal surgery?
No.
Okay. How about your family? So did anyone in your family have abdominal problem?
No.
Okay. So do you smoke?
No.
Do you drink?
No.
Okay, no. So okay, sir. Thank you so much. So now we will proceed on the assessment. In here, I will have your shirt removed and kindly wear this examination gown. So I will just get your examination gown for a minute. Okay. So kindly wear this, and I will make sure, sir, that I will expose your the assess or the abdomen, which is I will gonna assess later on. So, but before that, sir, I will have to get your permission if I could hold any parts of your body. Would that be okay?
Yes.
Okay. So before that, before you change your shirt into your examination examination gown, I will just close the door for your privacy and adjust the room temperature and adjust the lighting. Okay, so are you comfortable with that?
Yes.
Okay, sir. Sir, before anything else, before you change your shirt into the examination gown, do you want to pee? Do you want to empty your bladder?
No.
Okay, sir, so you can now change your shirt into your examination gown. Okay, so now we will help our patient to a supine position so that our patient would be comfortable. By doing a supine position, adjust the patient. Okay, sir, please do a supine position. So now we will add some pillow into our patient's head so that they would be comfortable. Okay, sir. Very good. Next is we will put some pillow into our patient's feet. Okay. Okay, sir. Sir, can you please do like this? Okay, like that. Okay, sir. I will just put this into your here in your boob area. Okay, so would that be okay?
Yes.
Okay. So Just adjust it first. Please hold it. Okay. So now we are going to check if there are any vascularities, stretch marks, scars, or any rashes or lesions into our patient's abdomen. I don't have seen any, so let's document that. It is a good finding. Next is, by the use of our pen light, we're going to inspect the umbilicus of its color, contour, and location. Okay. The umbilicus is good. So now we will gonna examine the abdomen, or we will gonna inspect the abdomen. So I will be inspecting for abdominal contour, or the profile line from the rib margin to the pubic bone. Okay. So I want you to take a deep breath, then hold it. So in this, in that it will make enlarge the liver or spleen more obvious. Okay. So can you please take a deep breath? Okay, nice. So now we will gonna measure our patient's abdomen. Next, I will be inspecting the abdominal girth. So since my patient already emptied his bladder, so I'll be positioning in a supine position, which is my patient is doing right now. So inspect the area in between the lower rib and the pubic bone, and note of any abdominal enlargement. Okay. So I will be measuring your circumference. Okay. So around your belly button using the measuring tape. All right. So I will mark your belly button to make sure that it is measured and at the same location, and I will mark it. So kindly please don't wash the marker if I will mark your abdomen, or don't rub it, okay? Okay, so please raise your abdomen for me. Okay. 31. So let's mark it using your pen. Alright. Okay, so I'm just gonna get it. Don't rub it, alright? So let's document the finding. So, alright, so I will be moving towards your foot, okay? To check if your abdomen is symmetric, alright? So abdomen is symmetric in a relaxed position. This time, can you raise your head for me if I will told you to raise your head? And if I will also check if they are bulging okay? So, okay. Can you please raise your head? Okay. Okay. So there are no bulging as well that might indicate herniation, and yes, dialysis movement caused by respiration and symmetric, as well as no peristaltic waves that are observed. Okay, that is a good sign. I will document that. Now, I will gonna auscultate for bowel sounds. So, alright, so I will gonna auscultate for bowel sounds in your abdomen this time. Sounds, I will be needing my stethoscope to auscultate for it, and don't worry, I already checked the temperature and it is already warm enough. I'll just be cleaning this one. Alright, so I'll be lightly placing my diaphragm of my stethoscope with a light pressure to assess the high pitch sounds with maximum of 1 minute. Okay? Okay, alright, so I will first checking the lower right quadrant into a clockwise. Next is the upper right quadrant. Next is the upper left quadrant. And next is the lower left quadrant. Okay, let's document that. So now I will gonna auscultate for vascular sound. So switching to the bell of my stethoscope to ask your date vascular sounds on the aorta. Next is for the arena artery. Next is for the iliac artery, and lastly for the femoral artery. So, okay. First is the aorta. Next is the iliac artery. The arena artery, rather. Next is the iliac artery. And lastly, the femoral artery. Okay, let's document that also. So now we will gonna auscultate for the venous hump. So this time I'll be auscultating using the bell of my stethoscope on your epigastric and umbilical regions for venous foam, which is not normally heard in those areas. So venous foam might indicate hypertension first, your epigastric, then umbilical region. Okay. Using the bell of my stethoscope. Stop it like that. Okay, so now I will gonna auscultate for friction rub over the liver and spleen. So last part of the auscultation, I'll check for your friction rub over the spleen and the liver using the diaphragm of my stethoscope. So alright, I'll be checking at the lower rib cage from left to right, okay? So. Okay. So I will document that. And that is the last part of the auscultation. Now let's proceed to the percussion. So for the next assessment, I'll be requesting your abdomen for resonant sound, all right? So remember to use a systematic pattern. Ask the patient whether abdominal pain is present. And if an area is painful, percuss it last. So ask the patient to point to the area of maximal tenderness, then start percussing on the RUQ and clockwise. So I'll be starting from the right lower quadrant and onto the upper quadrants, okay? So please inhale. Next part, we'll be assessing the span or height of your liver. So I need to determine the lower and upper border first. Okay, so to determine the lower border, I'll start at the right lower quadrant along the mid-clavicular line. Then I will be crossing upwards until there is a change from tympani to dullness. All right. Okay, I'll start right now. So I'll be marking if this will be your lower border. So mark it. Okay, then document. So we have already located the liver border of dullness now. Observe for the close of the lower border of the liver dullness below the coastal margin and deep inspiration. So certainly inhale and hold your breath. Okay, so just wait for my cue. Okay, then go. Inhale. Pause. Okay. Great, excellent. So we now move on in percussing the upper border of the liver. So locate the upper right chest at the mid-clavicular line and percuss downward, okay? Then mark the point where change from upper right chest, long resonance until liver dullness is noted, and which indicates the upper border of liver dullness. Afterwards, measure the distance between the two marks. This is the liver span. And repeat the percussion of the liver at the mid-sternal line, okay? So, okay, percuss. Okay, then mark. Okay. Then with the use of the metric ruler, line it. Okay. So right now, I will be percussing this line of your space. So for crossing the spleen, I'll start from the procedure of the left with the exterior line at your side. So that downwards, I'll be moving downwards until I feel change from long resonance to splenic dullness, all right? So, okay, so another method of practicing this being is to start from the anterior mid-axillary, which my patient will do like this. So certainly please raise your hand like that. Okay, so I'll be exposing this side of your body side. Okay. Then don't forget to document. Alright, so next is I am going to do one precaution to assess for tenderness, starting with your liver, so assess you to safety position. So can you please do like that, okay? Okay, sir, so I will be like punching you, but I assure you that it will not hurt, okay? So just tell me if it hurts. Does it hurt?
No.
Okay. So, okay, so I am done with that. So I will also do into his kidneys. Okay. Okay. So does it hurt? Does it hurt? Okay. So sir, thank you so much. So you can go back. So now that our client is in supine position, which is my client is doing, position in the lower and the upper body are covered, leaving the abdomen exposed. So let us expose your abdomen. Okay, let us now begin palpating on a non-tender abdominal quadrant using our finger tips and compressed to a depth of 1 centimeters and dipping motion. Then gently lift the fingers and move the next area and ensure that the client's position is appropriate for relaxation of the abdominal muscles and warm the hands. So, okay. Okay. So if the guarding is present, place a pillow under the patient's knees and do like this motion. Okay. Light palpation only. Push down about 1 centimeter. Then document. After that, begin palpating deeply all the quadrants to delineate organs. Use the palmar surface of the fingers, and to compress quadrants to a maximum depth of 5 to 6 centimeters. Note for any resistance or any deep structures, and remember to perform by manual palpation if resistance or deeper structure is felt. Okay, so gently pull it, then like that. This side. Okay. Document. Then use fingertips to compress all quadrants to a depth of 1 centimeter in a deeping motion to palpate for any masses. Initially avoid painful area and note for size centimeters. Location, shape, consistency, demarcation, pulsatility, tenderness, and mobility of any masses are palpated. Okay? We then perform moderate palpation of the umbilicus, its surrounding, to note for any swelling, bulges, and masses. So in the umbilicus. So in the palpation of the aorta, use both hands to deeply palpate the aorta and palpate the aortic pulsations on either side of the aorta. Okay? Okay, so I will just. And in palpating the liver, place your right hand at the patient's right MCL under the costal margin. And note that the fingertips should point towards the client's head. Then place your left hand on the patient's back of the 11 to 12 rib. Press downward to elevate the liver toward the abdominal wall. Then note for consistency and tenderness. So let's go to the other side. And now we will going to palpate the liver. So insert your hands like this, then palpate. Next is the hooking technique, is another method to palpate the liver. Place your hands over the right costal margin and hook your fingers over the edge. Have the patient take a deep breath and feel for liver edge as it drops down on inspiration, then rises over your fingers on expiration. So sir, can you please take a deep breath? Okay. Release. Can you please take a deep breath? And release. Deep breath. Okay. So after that, we palpate the spleen in a two-way method. First, stand at the patient's right side and place your right hand under the left costal margin. Have the patient take a deep breath during the exhalation. Press inward along the left costal margin and try to palpate the spleen. An alternative approach is to have the patient turn onto the right side, move to spleen more forward. Remember that a normal spleen is not palpatable. Also note that if trauma to the spleen is suspected, avoid pressing due to risk of rupture. Okay. Okay. So on the other side. So afterwards, we palpate the kidney to assess for kidney enlargement. Here, place the left hand on the right posterior flank and provide support. Then place the right hand on the right upper quadrant, just below the costal margin of the mid-clavicular line. And ask the client to exhale and hold breath briefly. Gradually release the pressure of the right hand, then repeat the procedure in the left kidney. Okay. So, can you please take a deep breath? Okay, wait. Exhale. Please take a deep breath. Take a deep breath. Don't release. Take a deep breath, okay? Okay. Next, don't forget to document. Next is to palpate the bladder using the deep palpation of the symphysis pubis and move upward and outward to the SM8 bladder borders. Note for consistency and tenderness. And palpable bladder is either full of enlargement from an underlying mass arising in the bladder or pelvis. A tender bladder usually indicates UTI. Okay? Now, let's test the Piosus sign. Ask the client to lie on the side, then X-ray extended the right leg of the client. Note for pain reaction of the client. So the positive Piosus test is going to be abdominal pain. Okay? So, sir, I will be rising your left leg. Does it hurt?
No.
Okay. So, the positive Piosus test is going to be the abdominal pain. So, is there abdominal pain?
No.
So next is to test the obturator sign. We will hold and support the client's right knee and ankle. Flex the hip knee and rotate the leg internally and externally. Note for pain and reaction of the client. And extend obturator irritates the appendix and causes pain. So the positive obturator test is gonna be pain. If the patient has appendicitis, the obturator test will be extremely painful. So, sir, I will again do the left leg straight. Okay, just tell me if it's painful or not. Okay, okay, is it painful? Okay. Okay, so this test is the Piosus test is gonna be abdominal pain. So, okay, so now the obturator test. Okay, so sir, okay. Okay, then like that. And okay. Then like this. Is it painful? A bit. Okay. So it is normal, sir, if you feel pain. Right? Okay. Is it painful?
Okay.
Okay, this side, is it painful?
No.
Is it okay? Good. So now we will document that. Okay, lastly, we will test the appendicitis using the rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area. Then suddenly release pressure. Listen and watch the client's expression of pain. And ask the client which hurt more, pressing in or releasing. Also ask the client where in the abdomen the pain occurred. Positive rebound tenderness where there is pain when the assessor removes their hand and is often indicative appendicitis. Okay. So let's do appendix. Do you feel pain? Okay, so where do you feel pain when I push it or when I release it?
Push it.
When I push it. Okay, again. Push it. Okay, okay, then great. Okay, so you can close now your examination and you can go upward. So after that, we should not neglect to disinfect my hands, and I will go back to my patient's room for the summary of the assessment. Okay, I will just come back, sir. Thank you so much for. Okay, so Sir Joshua, I'd like to sum up everything that we have covered as I observe here in my data and as I inspect, auscultate, percuss, and palpate your abdomen. There are nothing wrong with it. And if you have any questions or concerns, feel free to ask me, okay?
Okay.
Okay, so Joshua, thank you for your cooperation. I really appreciate it.
Thank you.
Okay, so that's the end of my return demonstration in the abdominal assessment. Thank you for watching.